What protein is found in the urine of patients with multiple myeloma? A. Binns-Jones protein. B. Tau64. C. Albumin. D. Alpha-synuclein. The answer is A. Binns-Jones protein. Binns-Jones proteins are present in the urine of over 60% of multiple myeloma patients. Albumin may be present in the urine of these patients, but it is not pathognomonic for multiple myeloma. Alpha-synuclein is associated with neurodegenerative conditions, and Tau64 is a protein present in the neurons of patients with Alzheimer's disease. What is the most common symptom of Hodgkin's lymphoma? A. Bone pain. B. Fatigue and weight loss. C. Easy bruising. D. Prolonged enlargement of one or more lymph nodes. The answer is D. Prolonged enlargement of one or more lymph nodes. The most common symptom of Hodgkin's lymphoma is the painless enlargement of one or more lymph nodes. Unexplained weight loss and fatigue may also be present, but are more likely to present later than lymph node enlargement. Bone pain and easy bruising are not typically seen. What tumor antigen will be elevated in prostate cancer? A. Cancer antigen 125, CA125. B. Tyrosinase. C. Prostate-specific antigen, PSA. D. Alpha-fetoprotein, AFP. The answer is C. Prostate-specific antigen, PSA. In prostate cancer, patients will have elevated levels of prostate-specific antigen, PSA. Cancer antigen 125, CA125, is elevated in ovarian cancer. Alpha-fetoprotein, AFP, is elevated in hepatocellular carcinoma, and tyrosinase is an enzyme that is often highly elevated in malignant melanoma. The oncology nurse cares for a patient who has been newly diagnosed with leukemia. Which of the following sets of symptoms would the nurse not expect during the initial physical assessment? A. Mouth ulcers, low leukocyte count, weakness. B. Throat ulcers, pneumonia, anemia. C. Lethargy, bleeding gums, petechiae. D. Headache, ecchymosis, retinal hemorrhages. E. Weight gain, high red blood cell count, flushing. The answer is E. Weight gain, high red blood cell count, flushing. Leukemia is a cancer of white blood cells, limiting the ability of the body to fight infection. Patients with leukemia exhibit altered leukocyte counts, less than 500,000 per cubic millimeters, as well as ulcerations of the mouth and throat, pneumonia, septicemia, anemia, fatigue, lethargy, weakness, pallor, weight loss, headache, disorientation, and forms of bleeding, including bleeding gums, ecchymosis, petechiae, and retinal hemorrhaging. Patients with leukemia do not usually exhibit weight gain, usually loss, high red blood cell counts, usually anemic, and flushing, usually pallor. The oncology nurse cares for a patient newly diagnosed with breast cancer. What are common risk factors for this type of cancer? A. Immunosuppression, advancing age, genetic predisposition. B. Smoking, advanced age, genetic disposition. C. Stress, advancing age, chronic irritation. D. Pharmaceutical use, alcohol, radiation. E. Radiation, chronic irritation, smoking. The answer is A. Immunosuppression, advancing age, genetic predisposition. All of these may be factors in the diagnosis of cancer. The operative word in the question is risk. Common risk factors for breast cancer include previous immunosuppression, advancing age, and genetic predisposition. Common causative factors include smoking, alcohol abuse, radiation, chronic irritation, consumption of food additives, exposure to industrial chemicals such as asbestos, exposure to dangerous pharmaceuticals such as stilbestrol, previous viral infections such as Epstein-Barr, and stress, when combined with other causative factors.